The knee seems like a simple joint, but it's not. It's made up of 4 ligaments that stabilize it. You also have 2 rings of cartilage that cushion the knee and help stabilize it, and then the kneecap is a bone that's inside the tendon of your thigh muscle that helps extend the knee. One of the reasons that the knee is so vulnerable to injury is the bones on each side of the joint are very long, which means that when you run and cut side to side, tremendous stresses can be generated in the knee joint. The most common injuries we see in athletes are going to be strains and sprains. More significant injuries involve tearing of the rings of cartilage. That would be a cartilage tear, a meniscus tear. Your most significant injuries involve tears of the ligaments, tendons, or even fractures of the bones. The best way to prevent a knee injury is to keep your knee strong, to maintain full range of motion, work with coaches and trainers to make sure you're using proper form and good shoe wear. In sports medicine, we're trying to transition from just treating injuries to preventing them. Over the last few years, there's been a lot of research done in developing training protocols to prevent knee injuries. And so I would encourage all of our young athletes to seek these out. Most are available online. If you can't find them, your coaches and trainers are great resources for that. Most knee injuries can be treated at home. Usually it's rest, anti-inflammatories if you're able to take them. Over-the-counter braces can help, heat once the inflammation subsides, and then a gradual return to your normal activities. You should see your doctor if minor pain doesn't resolve quickly. Any feelings of catching or locking in the knee should be evaluated, and swelling is also a bad sign. Certainly significant injury from a trauma should be seen immediately. Most knee injuries that require surgery involve tears of the rings of cartilage, the meniscus in the knee. It's a very minor surgery. Most people miss a few days of work. More significant injuries that require surgery would be things like ligament tears or fractures, and of course those are going to be a much longer recovery. Years ago, knee injuries were treated through large incisions. Originally, ligament reconstructions were done through incisions about that long. Nowadays we can do nearly all surgery through small incisions this big, and so really shorten the recovery time. Knee pain is very common in people as they age, but I always tell patients, don't just write that off and say it's because I'm getting older and use that as an excuse to slow down. We have many ways of dealing with knee pain, even if it is coming from arthritis. That's not something you have to live with. I always encourage people to seek treatment so they can stay more active.